Hi everyone, I'm Claire.
I'm Ben.
And we are Your Dental Besties.
Making dentistry fun.
I liked that little look we just gave each other before we started. That was nice. It was kind of
I thought you were looking at me like, I forgot what to say.
Maybe I'd love that.
Wipe the fly juice off my hands.
Ben had to do the clapper. So he did that, but he was like, "Psh," and he got a fly at the same time. It did look ninja.
I know.
You're like, "Psh."
Went for a walk the other day and there's a place in Oxford called Port Meadow and it's basically just a giant floodplain. So in the summer, like cows and horses go on it, and in the winter, it just floods. And I went after I'd been to the gym, and I was in shorts.
Yeah.
Wrong decision, because it was like mosquito heaven.
It is.
My legs were like bitten to shreds.
Oh, it's awful. I ran the other day around this. I've got this lake near me where I run around it. And we were doing intervals, so it's like a lot of heavy breathing because you're obviously running fast. And there was like, they go in swarms, don't they? And but they were like head level for me, and I was just breathing them in. Like I got my protein intake that day, just eating them. They were like in my eyes, and then because I was so sweaty, because it was obviously, and I had a short sleeve top on, so like my arms were sweaty, my chest was sweaty. They were just stuck to me, like a windscreen.
Yeah.
Like, they were just stuck to me everywhere. I was like,
We just want to eat.
I was like, oh god, and yeah, disgusting. I was quite fast, to say I was like all the way through. She would think that would slow me down, but I was like,
No, you're determined. You're like,
yeah, protein. Ah.
I'll eat my way through you. Nothing's stopping me. Yeah.
Bear Grylls, I'll eat anything if it's got protein in it.
Oh, God, that's gross. They'll probably be my dog's poo.
They are the most, we're scared of things like sharks, lions, but the most dangerous animal in the world is mosquito. They've killed more people than any other animal or anything ever.
Why are you scared of sharks and lions? How many sharks and lions are there in Doncaster?
Good point, because there's lots of mosquitoes, but I'm not scared of them. I just don't like eating them, and they're annoying.
We don't get malaria here, though.
No, but I am petrified, like it's irrationally petrified of, irrationally is the word, isn't it? Not unrationally. Is unrationally a word?
Irrational.
Irrational. I have an irrational fear of sharks, to the point where I won't even put my foot in the sea in Bridlington.
Why? Because you get eaten by a shark?
I am that unlucky, I will get eaten by a shark.
They were like a freak accident.
It's just, I feel like it would be the most agonising and petrifying death.
It's not. Well, I say it's not though. Like I've been eaten by a shark before, but when you hear of like surfers and stuff getting attacked by sharks, a lot of them just feel like. I remember reading one on the BBC, because there's always in Sydney, isn't there? And there's always like a flurry of them if there's a shark in the area. And one of them said it just felt like I'd been hit by a car, like that kind of force.
Yeah.
And you didn't realise that you had like no leg. Because the teeth are so sharp, they just like bite into it and tear it off. And I love sharks. And I was watching a video the other day of them they were trying to get a massive female great white shark so they could tag her.
Yeah.
And they got like a tuna, and you know how big tuna are, and they're like solid fish. And you could see her circling. Anyway, she comes up, bites the tuna, and literally just bites the whole body straight off the tuna. There's just the head left.
But it makes
she was 16 foot long.
Is it Big Blue? Is she called Deep Blue or Big Blue or something?
I think it was, it might be something like that. She's massive.
She's the biggest one. Yeah. Oh, God, no, petrified. And I think as well, like, I mean, to be honest, the force when they come from the bottom up and like obviously clamp down, like you're gone around.
If they go down, I think if they're swimming around, they're just like exploring. And if they're like trying to take a little snack, it's like they want to know what's going on.
Yeah.
But it's when they come from the bottom and they come up, that's like they're full, because that's when the shutters go over their eyes. Because they've got like a second eyelid to protect their eyes. So they're coming up and the shutters go over their eyes.
Is that because they're going so fast that their eyes need protection?
They'll protect, yeah. Same with crocodiles.
Oh, yeah, scared. I mean, I'm not as scared of lions, I think, but I mean, do you know what? I'm also scared of bears, and you know this because obviously we're going to Canada in like literally a few weeks' time.
A bear?
Yeah, and we're going to Calgary. Is that where we're going to go hiking?
Claire didn't even know I was going. I was like, should we drive there? She was like, yeah. I was like, put it in the map, see how far away it is. And she was like, what do you call it?
North.
Bedmonton. I was like, no.
No, I said Northington or something like that.
Northington, that's it. I was like, no, that's not where we're going.
Oh, God. But we're going to go to Calgary and then drive to Edmonton, but that's a lot of like country roads and it's
Canada. It's like
I know, but are we going hiking in like the
yeah.
So I was like, the chances of coming face to face with a bear is going to be on the higher side. They eat you alive. Oh yeah. I've read stories.
What,
I'm like,
instead of eating you dead?
No, that you'll be alive. I've read a story where.
Yeah, but instead of dead, what do you want them to do?
We'll kill you and then eat you.
We'll be like, I'm just going to shoot you and then I'm going to eat you.
No, like, give me a hard swipe so I'm dead and then eat me. But they'll like just basically get you to a point where you can't you pin to the floor and they're just eating your stomach whilst you're conscious.
Yeah.
It happened to a girl.
Did you know her?
No, I didn't know her, but I read the story and like some sort of.
Take a break.
Yeah.
Oh, God. I got eaten by a bear, but I survived. No, I don't think I'm that scared of any animals. I've always wanted to shark dive.
Oh, you're just feeding yourself. You're just handing yourself to them on a platter.
Have you seen that movie Cocaine Bear?
Yeah, I have actually.
That's actually a really good movie.
Do you like it?
I watched it. Yeah, I was like, it's so funny.
It's so
based on a true story.
It is based on a true story, which is crazy.
Imagine a bear on coke. It's when it started to climb the tree, like it just like whizzed up the tree because it was like cocaine. Yeah, maybe snakes. I was scared of tarantulas, but then I went to a comedy night in Oxford. It was brilliant, and it was a comedy night all on bugs. And then it was in a museum, and then like in the interval, you could go out and you could handle all different bugs.
That sounds like a really cool evening.
Oh, it was so good. Oxford's like really cool like that. It's such a small place, but there's always like interesting stuff going on.
Yeah.
And I handled a tarantula, and she was a happy one because there's a grumpy one and a happy one.
Yeah.
But I handled the happy one, and it just feels like an egg.
Oh, really?
He said if you dropped her on the floor and
they don't have
it should like break.
Yeah,
so
they like splat.
Then I was more paranoid about I didn't want to kill her.
Yeah, because they've got no bones, so they just splat on the floor, don't they?
Yeah, so sad. But I didn't kill her.
Oh, good. That's good.
So just snakes, maybe.
Yeah, I'm not that bad with snakes. Do you know what I think is really scary?
What?
Mouth cancer. Did you like my segue there?
Fucking hell, it's quite the bloody reach, but okay.
Segue. Because I wanted to talk to you about your cancer checks and how you go about doing it, like your physical, like step-by-step process. I was going to bring some gloves so that you could like do it, but I forgot to bring the gloves. So in true Claire fashion. But what we could do tomorrow is, because we're at your practice tomorrow, we can maybe do a video of doing it and then drop it on the bottom left-hand corner of this one as you're saying.
So cancer checks. So first of all, I'll do extra oral. So I always say to the patient, I'm going to feel around your collarbones. Is that okay?
Yes.
Because I think sometimes if I'm just like starting to slide my hand down the top, they must be like, what the hell? So feel around there. I'm just feeling around for any hardness, any lumps, any bumps. So I feel around, and then I'll work my way up the front of the neck. Then I go behind the ears, and then back down under the mandible.
Yeah.
And then I'll slide my fingers back behind the ears and work my way back down the back of the neck. Mm-hmm. Then I will look around the soft tissues, pull that up, down, left, right. And then I get them to stick their tongue right out, and then to the left, to the right, to the roof of the mouth. And then I'll sit the chair right up. I'll get my mirror and I'll look at the tonsils, and then I get them to stick their tongue right out and move it to the left, and you can see kind of like the tonsil, what's it called?
At the back, yeah.
And then I get them to do the other way, and then that's it. And then I always say, have you had any sore throats, any hoarseness, any changes in your voice, anything that just doesn't feel right?
Yeah, I don't actually say about any changes to your voice or something, but that's an important one, because if they turn around and say, do you know what, I've had this like raspy, hoarse voice for like 4 weeks, then that's something to go and get investigated, isn't it? That's interesting. I don't ask that, but I'm going to now. The only things that I do differently is I'll get them to, so I go down their neck, and obviously same as you, I ask permission to go like on the clavicle, and then I'll say to them, when you're doing your self checks, always make sure you feel around the clavicle, because you've got some like lymph nodes around there. And I think a lot of women and men, when you're doing your breast cancer checks, or you should be, you want to be going right up to that area as well. I think people just forget that that's an area. So I do that. But then what I do is I get them...
Hold on. I should be doing breast cancer checks.
No, but I say to my patient, when you're doing your self-checks at home, make sure you go up as high as that as well.
I'm not talking about doing breast checks in the surgery, Claire. I'm talking about doing breast cancer checks at home.
I mention it to my patient when they're doing their own checks to always check around there because people don't check there.
Yeah, but what are you talking about breast cancer checks?
I just say when you're doing your... So I just say, just out of interest, when you're doing your own checks, make sure you are checking around there as well.
Yeah, but what we're checking at home?
Breast cancer checks.
Yeah, that's what I'm saying. What is that? Should I be doing that?
Not on the patient. You, yeah.
As in personally?
Men can get breast cancer.
I don't do a breast cancer check.
Men can get breast cancer as well. You do want to be just making sure everything's okay.
Well, just feel my boobs.
If there's any like lumps, bumps, changes, yeah. Men can get breast cancer too. That should be a hashtag. Men can get it too.
Yeah, I mean, I feel like I'm an ironing board. I'd probably feel if I see something.
And there's like lymph nodes and stuff under armpits and stuff like that. But yeah, no, men can get breast cancer too. So you should. I'm not saying but just like you say, you're probably okay. You're slim, aren't you? So if you're going to see any lumps and bumps, you're going to feel it. But some men might not. It might not be as obvious. So they should be checking.
I think a lot of men just don't do any check at all. Like ever.
Yeah.
I know I'm generalizing here, but I don't. But again, like we're not really taught like what we should be doing, what we shouldn't be doing. I didn't know I should be doing breast cancer checks.
Yeah, I mean it's probably easier because we've got a lot more tissue to work with, and there's things are going to be hidden a lot more. But yeah, like under the armpits and in the clavicle, and just
Good. Okay, carry on.
So then I get my patient to turn their head over to the left and then over to the right, but I get them to really exaggerate it so that,
Ooh, that's a good idea.
Yeah. But you know why else that's really, really good? So when I get them to do it and then I get them to exaggerate it, obviously it gets this platismo or whatever to stick out a bit more. So when it's tight skin, if there is any lumps and bumps, you can see it like taut. But also it really exaggerates what I'm doing so that they can really feel like I'm giving it a really good thorough, like that's another reason why I think it's always really good to like feel right down into here so that they can sort of see it's full from the shoulders up. We're doing it and doing it properly. And then the same as you, I go, I do TMJ. Once I'm here, I do TMJ and then I'll go down underneath the mandible, behind the ears. And
I think behind the ears gets missed a lot.
It does, yeah.
When I see people doing it online, like we do oral cancer checks, I'm like, yeah, but you missed half the head. Like you got to go behind as well.
Yeah. Yeah. Oh, yeah. Because you've got like a cluster around here, so you definitely need to go back there. And then something that a neurosurgeon showed me is I get my thumb and I put it into the floor of the mouth. So I get them to lift their tongue up and then get my fingers underneath the mandible and have a little palpate around there.
Ooh.
So it's into the floor of the mouth. And if you feel anything down there, that's that obviously you can feel it more when you've got your finger underneath and then your thumb into the floor of the mouth. And then the same as you, tongue out, left and right, roof of the mouth, and then tongue out, and then I look right at the very back and tell them say ah. It's like the good old thing that people recommend know from dentists. Ah. So you can see right at the very back. And then I'll feel around at the parotids as well. So I'll get my finger in and feel around the parotids, and then it's all the soft tissues inside the mouth as well. Yeah.
This sounds really ignorant, but can nurses do oral cancer checks?
Do you know what? I can't. Maybe not. What training would they have had in oral pathology? So maybe not.
Why?
Unless they do a course in pathology.
But why? The feeling for abnormalities.
Yeah.
They're not. We don't diagnose. No. We can't say. Like there's been a few times where I'm like, I'm not like happy with that lesion. I'm going to take a photo of it. Yeah. Well, what is it? And I'm like, I don't know. Like I can't diagnose because I would need to take a biopsy, and I don't do that. That's why I'm referring you. But why not?
Yeah, but they'd have to have a course to be looking for like what looks right and what doesn't look right. So is that on a dental nurse's course? But is there another course they can go on that gives them the ability to be able to do that?
I just think
how would they be used?
There's an increase in all cancers because everyone's living longer. So why are we not utilising the full team to be doing oral cancer checks? And I spoke about me going for a facial. All I could think about in my head, and I forgot to ask, God damn it, is, are you trained to do oral cancer checks, like head and neck cancer checks? Because of how they move and they like touching the anatomy all the time, their perception of what's right and what's not right, even just by feel, not knowing anything other than that. If we trained those professions, it's just increasing awareness the whole time. And it doesn't necessarily have to be we're doing an oral cancer check, but it's just this doesn't feel right. I think you should go see a dentist or a doctor.
Yeah.
But I forgot to ask. But it's so stupid. But I was like, it should be part of your course.
Yeah, definitely. In terms of the dental nurses, some practices might say then they'd have to have a chair, and then that's a chair out of service.
But do they have to have a chair? They can just have a normal chair.
Yeah, maybe. Yeah, because the patient can just put their head back, can't they, and turn.
They can just stand behind the patient and just feel.
In terms of what you just said there about the beautician, I'm seeing a lot more, well, not necessarily seeing, I'm not seeing it, but I'm hearing of it more. Women with like thyroid sort of issues and like swellings, and it turns out to be like thyroid. And I've had a few patients that have had to have like the thyroid removed and stuff like that because of cancers and stuff. So I don't know what that's linked to, but I feel like I'm seeing that a lot more.
My sister had thyroid cancer.
Did she?
Yeah, she had to have hers removed.
Is it more common in women than men then? Because I feel like it's always women that I see it on.
I think thyroid issues are a lot more common in women.
Is it? Yeah.
Than what they are in men. It's not to say men. It's not like a 99% and a 1%.
Yeah.
It's more. I think it's more like a 70 and a 30% more common in women.
Yeah.
I don't know.
I saw a story the other day. Literally, it's just come back to me here as you were talking there. I saw a story the other day about this woman. So she was in her 20s, so young. She had a little lesion on her tongue. It was like a little bump. Did you see it?
I saw it, and the dentist was like, "I'm not worried about it." And she went back like 3 weeks later.
Yeah,
and it was like massive.
Yeah, and then by the time she actually got it like biopsy, she lost like half a tongue, and she was like, she obviously had to have radiotherapy and all that sort of stuff. And yeah, scary, isn't it?
It's super scary, and I think it's really destructive. Like if you have a biopsy on your thigh, there's loads of skin, loads of tissue, you can hide it. Whereas on your face, like an 1.5 inch biopsy is a massive hole.
Yeah.
Like to be cut away. And obviously the scar tissue, our expressions, how we talk, everything's just very sensitive.
And then losing half your tongue, which is something you need to talk, to eat, to taste. Quality of life. Like it's one thing having like maybe a scar on your face or like something going on your face, but your tongue is a functional like muscle that's needed all day, every day for numerous things.
It must be awful. Although we see a lot of patients, obviously working in the hospital, the students see a lot of patients who've had like partial resections and things. And the patients generally manage well, because I suppose when you've had that to that level, you're just thankful to be alive.
Yeah. I suppose that there's an element of like, I don't care if my face is half gone. Like I'm still alive. That's all that matters.
I think this hopefully is going to go out before the dentistry show. But Mike and Joss are doing their oral cancer. She's now the president of the Mouth Cancer Foundation. So congratulations, Joss.
Yes,
you deserve that so much. But they're going to be doing talks on it, and I think. Yeah, if you get a chance, go see them.
Yeah, I think that's
it's good about the dentistry show.
Yeah, all that CPD. Well, yeah, all those speakers.
CPD, the good good speakers. Yeah. It's free.
Yeah,
you get your CPD, and you're getting like up to date information because every year they're bringing new people out. So, and we're going to be there. Oh, and
we're going to be there. We're doing 2 podcasts, one in the morning, one in the afternoon. So come and
we're going to have some special guests.
Yes, I think they are to be confirmed. I think one's been confirmed for the morning.
One's been confirmed, but we're not going to tell all the secrets.
But we would like you to come and join us. That'd be really, really good. I look for. I've said it plenty of times on this podcast. Like it's the highlight of my year. That
it's
show.
It's absolutely mental busy, but
it's exhausting when you're working.
When you're working it, it's like just intense chaos, good fun, like camaraderie . But yeah, it's a good event. Yeah. It's a good event. It's just so big.
It's huge.
Birmingham's massive.
If you need to go for a wee, then it takes you like 2 hours to go for a wee because you see so many people on the way to the toilet, and you
sunglasses on. I take my glasses off so I can't see anyone.
Head down.
Don't recognise you unless you're like 2 meters in front of me. Bye.
It's when Harry's like, "Why have you been gone for 2 hours?" And you're like, I got stopped 5 times on the way to the loo.
Yeah. It's good fun.
Yeah, come to the EMS stand as well because they're going to have like cool things going on there. It looks really, really good fun this year.
Really good.
Yeah, podcast stuff going on there as well. So
Listerine's changing theirs.
Are they?
As well, yeah.
What are they doing there?
It used to be like a little...
Like a booth?
Yeah, it used to be like a little booth. And then like an information stand. I just think everyone's going for this more like open kind of feel. So yeah, they're changing it up as well.
Oh, that sounds good. It is good. Please come. It's on the 15th and 16th of May, and we'll be there. So we hope to see you.
Yeah, and come watch the podcast.
Yeah, come watch the podcast, come be involved, and we'll be walking around on the Friday. You're not there on the Saturday, are you? On the Saturday, I'll be working at EMS, so come and speak to me on the Saturday. But, gee, my stomach keep rumbling. Yeah. Oh, I've eaten like a handful of crackers. I don't know why I'm like...
A handful of crackers, that's probably why your stomach's rumbling.
I had a cracker bread yesterday. No, but I'm glad, I wanted to have that discussion about mouth cancer checks because I feel like it's a really important part. We should be doing them on everyone. And I think people do them slightly different ways. And I've definitely upped my game since working with an oral surgeon. So when I went into surgery and I was like, can you show me how you do oral cancer checks? Because I want to make sure I'm doing mine properly.
I think it's just often one of those things where it's like, I've got so much to do in the appointment. Oh, the dentist's done it, so I'll be fine. But it's like... best stuff having as many hands and eyes on that as possible.
Yeah, because they can easily miss stuff too.
Yeah, we're all human.
We're all human. And the thing is, like, it's not always painful. So, and then HPV being such a rife thing.
Leading cause of head and neck cancer now.
Yep. So that's why it's happening in these younger people, like that woman in her 20s. That could be why that happened. I didn't actually know if it was related to HPV. Was it related to HPV?
No, I don't think it was. I think it was just really aggressive cancer.
Yeah. And all it takes is a mutant cell. And the thing with the mouth is that because cells turn over so much faster than other cells in the body, that's why things spread so fast and so quickly.
Yeah.
So
and it's so vascular.
Yeah. So missing something, it can lead to, we might not see them again at all. We might not see them for 3 months, 6 months, whatever it is. And in that time, it can change so drastically. So yeah, I've only ever seen like what I assume was HPV on someone's lip. Yeah, lower lip on the inside. It was like a little wart.
Yeah.
Obviously, straight to the oral surgeon. It costs quite a lot there to have a biopsy. It was like £500 to have a biopsy, and obviously you'd have to send it away, which then had an added fee on top of it.
Yeah, it costs a lot, but again, maybe it's just me, but if someone said we can biopsy it to make sure, I'd be like, whatever you need to do.
Well, I'd want it off anyway if it's like a high risk of cell changes and stuff like that. So I suppose the alternative, if you don't want to pay the £500, is go to your GP and see if you can get that referred.
Yeah.
And maybe that's what they should have done, sent him off with a letter. I don't think he did.
Well, it's private care, isn't it? I want the biopsy tomorrow instead of waiting.
Yeah. So yeah, it's important.
Do your oral cancer checks.
And they don't take long.
They're actually done, 2-3 minutes.
Yeah, and then when I had my audit for my notes, it said, what advice did you give for oral cancer? And so what I write now in my notes is obviously oral cancer checks, extraoral, anything I find, oral cancer checks, intraoral, anything I find, and then I put oral cancer advice given, and then if they're low risk, I'll say patient low risk, so that it shows why I might not have had much of a conversation about it. And then if obviously there's smokers or if there's high risk, then I say that I mentioned that. So the other thing I was going to mention to you, we did speak about skincare today on one of the other episodes. So obviously we're doing head and neck. How much are we looking at above, mouth up? Because I think a lot of people do miss, I always look, when someone's bald, I always look at the top of the head. I feel like I always see things on the top of the head. You
do. And I think that's when we went to that BSDHT meeting in Northern Ireland and we had that dermatology nurse. Was she a dermatology nurse?
Yeah, she was. Was she a doctor or a nurse? Yeah.
She was honestly fantastic, eye-opening. And I was like, wow, I need to look more.
Yeah.
Because we do see stuff. We see stuff all the time. Tops of bald men's ears.
Yes, and I've started putting SPF, when I go on holiday, I don't necessarily do it in the UK. So UK SPF on face, always, décolletage neck. But I must admit, actually, I don't do it on my ears.
I do it on my ears.
But when I go on holiday, I always put SPF 50 on my ears and then in my parting as well. Because obviously that's exposed skin, isn't it?
Well, just cover my whole head.
Yeah, which is what you did with the SPF and it had fake tan. Well, I sent you a message saying, did you stop at your hairline or did you go all the way to the back of your head?
Honestly, when I put that on, I was like, in my head, I was like, fuck. Because my boss was coming in 2 minutes.
Was it instant SPF as well?
Well, I don't know what it was. I went to the shop and I bought my SPF as normal, okay? I wanted my same La Roche-Posay or however you say it, SPF. I've got a special one and it's got a blue band on it because it's really light, and I'm probably autistic because I hate any feeling of anything on my skin.
Yeah.
Used it for ages. Went, and the only one that had was this other one, and it had nicotinamide or something and vitamin C in it. I was like, yeah, do you know what? It's probably the same. They just added more ingredients, so I just bought it. Didn't think anything of it. Then in the morning, squeezed it on my hand, didn't even look, just rubbed it in my hands, rubbed it all over my face, got ready, and then went and looked in the mirror before I was about to leave the house and was like, what the hell? My head is a baked bean on a matchstick body. And I was like, my bus is going to be coming soon. I don't have time to wash whatever the hell this is off my face.
Yeah.
So I put my sunglasses on, put my hood up, got on the bus like that, thinking, please God, don't see anyone. It was Sunday morning. It was 7 o'clock in the morning on a Sunday, so no one's going to see us.
Yeah.
When I got to the gym, I was like, I'm going to have to wash this off. So I just washed it off with hand wash. And then I was more pissed off because I was like, my week of skincare, which I've been committed to, is now ruined because I'm using basically toilet cleaner on my face to get this off.
And did it come off?
Yeah, it came off. But apparently my like sports massage lady who works in the gym, she was saying that there's a new ingredient in SPF that I don't know how it knows, but the areas where you get more UV, it must be UV activated, then it becomes darker to protect the area.
Oh.
So it's maybe acting like a fake melanin or something. I don't know. So she was like, maybe that's why, because it was like really dark on my forehead and my cheeks.
Yeah.
But like my temples and around my eyes and around my lower face, it didn't get that dark.
Yeah.
It was just horrendous. I was like, oh my God.
It's such a funny picture when you put that on though. I was
like, what the hell? This is just my luck.
I thought you'd gone to bed and then woke up the next day and it was like
no.
another one.
No.
That would stay on for ages.
Yeah, no. I did think, I was like, oh, it do actually suit a tan though.
Josh, just reminded me, I've forgotten to bring my fake tan with me. Whenever I stay in a hotel, I like to take fake tan so I get their bed sheets.
Oh, you demon. Imagine that's awful to wash off.
I don't want it on my bed sheets. I always do that, but I forgot to take it this time.
Just get someone we go into town.
Yeah, good idea. I'll do that. And the best.
I'll buy more skincare.
Should we go to Sarah?
Yes.
We're so bad. We're so bad.
My weekly haunt.
Okay, we're going to go shopping now. See ya.
Podcast what? Bye.
Oh dear, well, I think we are coming to the end of this episode, but I think that was a good one, and I'm glad I know what. In fact, tomorrow what we'll do is when we go to your practice, because we're doing our BLS training tomorrow, aren't we?
ILS, actually.
Oh, ILS, and I'm cadging onto your training. So, two of the practices that I could have possibly done it at did it on days where I literally couldn't change my work, so I couldn't do it.
Kind of worked out well then.
It's worked out really, really well. So I was like, oh, when you said you were doing it, I was like, can I cadge in on that?
Have you done ILS before?
No, well, I've done BLS and then it went into ILS afterwards because obviously, and then half the room left because they didn't need to do the ILS, but I stuck around. So yeah, looking forward to it. Be a nice day out. Have you just gone buzz-eyed?
No, it's like a bit of fluff.
You literally went,
I've told you my focus. Like fluff, what?
Yes. So tomorrow what we'll do is we'll get in the surgery and we'll do an oral cancer check-in and I'll put it on as a little video.
That'll be good.
Yeah.
I've got my tripod somewhere.
Yeah, let's do it. Get some content.
Look at us. Content.
This will not happen.
Yeah.
Okay, well, if you like this episode, please do like, comment and share. And if you do anything different, then let us know because obviously we want to learn from you as well. So like if we've missed something out there that's like fundamentally... we might have done, so I'd like to know. Mention what it is that you do that's different, and then we can potentially add that onto our cancer checks.
Yeah.
Sounds
Let us know.
Yeah. Bye.
Bye.